Hi. All right, so now we're going to perform cleaning of the trach. Before we get started, we need to identify our patient, name of birth, allergies, clean our hands with antiseptic or wash your hands with soap and water, apply clean gloves. All right, and make sure you have your equipment gathered, which is going to be a tracheostomy cleaning kit, sterile saline or sterile water, and hydrogen peroxide. If these have been opened before, make sure you check the expiration dates or the last time it's opened. We'll come back to that in a minute. All right. With your clean gloves, with the PPE that you'll be wearing, it's once again, you'll be wearing clean gloves, a full gown, a face mask, and a face shield. But for demonstration purposes, I'm not going to be applying those and for time reasons at this moment. Okay, but you will be required to wear all of that PPE during your test-offs. All right, so with your clean gloves on, you're going to remove the old or the soiled, I'm gonna undo this gown just a little bit. Ooh, sorry. And you're going to remove the old sponge gauze, get out of the way. You can, if it's has a lot of drainage on it, or if you think it might be infectious drainage, make sure you put in a biohazard bag. But this patient, we're going to say that they are clean, and we're just going to put it into the trash. Okay. Now at this point, I can hyperoxygenate my patient before I put on my sterile gloves, or either with a mask or with the ambu bag. And remember, like I said, this is a pediatric face mask, but we're just using this for demonstration purposes. If you do have a mask, make sure it blows by the trach. All right, now setting up your sterile field. These were my clean gloves I used. Clean my hands again before going to sterile. Open up your sterile kit away from you. With this, you have several options of the different ways you can do it. I'm going to show you my preferred method, which is going to be to first, I'm going to take out what's on top, which is my gloves. I'm just going to set it to the side. Next, I'm going to take my drape. Remember, shiny side goes down. I'm opening it up. It's holding pretty good. Okay. And this is going to be my sterile field. I have a 1-inch dirty border around it now. Okay, what I'm going to do with these supplies is I'm going to fold this wrapper back, and I'm going to do my best to dump it on the middle of my sterile field. That worked. Okay. Next, I'm going to move it over a little bit. I'm trying to get everything ready by only touching my 1-inch parameter. If these are open, I'm going to lip them into my trash can. Let's say I have my trash can right here. I lip into the trash can, and then I pour it into my container. I'm not going to pour it right now for demonstration purposes, but just know that you would pour sterile saline into one side, and then you're going to pour your hydrogen peroxide, and see how I'm going around my sterile field into the other side, after I lipped in the trash, of course. All right, now I'm going to put these to the side. I'm actually going to put them behind me, but I'm not going to turn my back to my sterile field. I just want to get them out of the way. All right, at this point, I need to don my sterile gloves. And see how right now I'm standing with the bedside table. I have all of my sterile fields within my view. I haven't turned my back to it. Now I'm going to don my sterile gloves, my dominant hand first. First. Now my non-dominant, I'm just going to leave this package over here. It's not in my way, so I'm not going to try to move it. See, my thumb is up while I'm applying it. My hands are sterile. Now at this point, my hands are sterile. I can arrange my supplies how I would like them. I put all my Q-tips together. These are my cleaning. This is my neckties. And I'm going to separate my gauzes. See, I have one that is perforated to go around my tracheostomy when I get done, and these two are for cleaning. All right. Those are for drying. All right. At this point, I'm going to have to break sterile filled with one hand. I'm going to choose my non-dominant hand, which is my left hand, to remove the inner tracheostomy. However, let me back up just a second. You do have another way to do this where you can remove that inner cannula before you don your sterile gloves, and you can remove it with clean hands, then apply your hand antiseptic, and then start your sterile fill. After the point where you open up your drape, dump your supplies on here, dump your water, because you're doing all that with bare hands, and then you can put on clean gloves, remove the inner trach, drop into the saline. That way, when you get to this point, you won't have to break sterile filled with one hand. But either way is right. What you need to remember, as long as you keep sterile, that's all that matters, right? Okay. So since I haven't removed it already, I'm going to break sterile filled with my left hand. And a real patient won't, the outer trach won't slip out how this one just did. I'm trying to push it back in a little bit. Okay. And I'm putting it into my saline. What I just have to remember at this point is this hand is dirty and this hand is clean. That's how I'm going to say it to keep my mind straight. However, remember, if you remove that before donning your sterile gloves, you could remove it with clean gloves and then have two sterile hands. Okay. Now what we're going to do is let that soak for just a minute, and then we can use, if it has a lot of secretions on it, you can twirl around in here. You can have it in the saline, and then the peroxide is what you use if it has a lot of secretions to help get the extra secretions and all off. Just remember, after you put in the peroxide, you have to put it back in the sterile water and rinse the peroxide off. All right. With your cleaning, you can put into the saline or the peroxide, whichever one you're working with, and scrub it. Just at this point, you have to make sure that if this hand is not sterile, that your brush does not touch your sterile hand, because we want to keep the cannula as sterile as possible. This can go inside of here to scrub around. You can scrub all around the outside, and you can go from that way when you're done. Okay. So this is now dirty. You can drop it into your trash can. I'm just going to drop it right there for the moment. If it has more secretions, you could use a Q-tip if you needed to, but more than likely that brush should do the job. And then to dry it, see, I'm taking my sterile hand back into my sterile field. I can use these pipe cleaners to dry off any excess water. You can dry off the outside and the inside. Or you can use one for the outside, drop it, and then use one for the inside and dry it. Okay, drop into the trash. Just make sure when you drop into the trash, your hand doesn't drop below your waist. Okay, so now at this point, my inner cannula is clean, right? But you see with this hand, that my dirty hand, essentially, it hasn't moved past the point of the external part of the inner cannula. I'm going to use this same hand. It's kind of hard with your left hand because it's not dominant for me. And then click it back into place. Now at this point, I can clean the face plate, and I can clean around the tracheostomy itself. You can use the Q-tips here. You can have them in the saline, or you can use the peroxide. Like I said, if it's really soiled, you can use the peroxide. You can even drape them in there. If you have a lot of drainage on the faceplate, you can puff up the gauze like this, where you grab the four corners. So you see, if I press down on something, my sterile fingers are not going to touch the surface. You can moisten it, and then you can use it to wipe around and clean the faceplate. Okay, and you have two for that. I'm just going to use one at the moment. And then now you will use your Q-tips and continue to clean. You want to make sure that you clean from the innermost to the outermost and go around. And between each swipe, you're getting a different Q-tip. And then also make sure that you clean underneath the face plates as well. Clean from the inside to more the outside perimeter of the patient. Okay, I'll go ahead and use all of those. And at that point, I'm done with the cleaning portion of that. All I have left to do is to place this gauze. And it's fine for me. I'm going to have to touch this with my dirty hand at this point. I just need to make sure I don't touch the middle part of this gauze and break or contaminate where it's going to be touching the tracheostomy opening. Okay, and just do your best, the best you can, to slide it underneath here. There you go. Okay, your final step is going to be to replace the ties. It's important that you don't take both your old off until you have your new one on. Because if the patient were to have a coughing fit in the middle of your changing your ties, the tracheostomy could come out. Okay, so we don't want that to happen. So we're going to tie our new one on first. And when you tie it on, it's important that you use little slip knots to make sure if there was ever an emergency situation where they had some swelling, that we could undo it very quickly. Right. Slip knot over here. Ask the patient to lift up their neck a little bit. Wrap it around this other side. And some of these have Velcro instead of ones that you actually tie, which is fine as well. It all depends on your manufacturer. See how I have it tight here, but if I were to pull it there, it would come off pretty easily. So now I'm undoing the old ties. I have one side undone. That's the patient. Yes, yes, sterile field is over because once you have this gauze on, you're done. And it's stuck. It's stuck beside his head. Okay, and then, ooh, see, someone tied this one the wrong way, so it didn't come out easily, but there you go. So you see now how our new ties are tied where you can easily just pull this and it would come loose. Okay. Tie that back. Okay. Do y'all have any questions? We're all done.